Hi, this is Latanya Reed. I will be doing a head to toe assessment. First thing, I would gather my equipment. Hi, Mr. Smith. How are you doing today?
Good, are you?
I'm good. I am Latanya Reed. I will be doing a head to toe assessment on you today. Would that be okay?
Sure.
All right. Could you tell me how you're feeling as far as are you in any pain?
No, no, no.
Good. And could you give me your full name?
John Henry Smith,
Okay. Do you know why you're here?
a knee injury,
All right. Do you know what today's date is?
December 9th, 2021.
All right, so that means Christmas is coming. You ready for Santa Claus?
Oh, yeah, as much as I'm going to get.
All right. Okay. May I also do your vital signs?
Sure.
Okay. Hand hygiene. He's alert and oriented times 4. He's in no pain. And I'm going to do his vital signs. We don't have our thermometer, but this is the thermometer. Open your mouth, please. Under your tongue. All right. Got his temperature. Got his pulse and respirations. 30 seconds, 15 for each. Getting the blood pressure. The cup doesn't fit, but act like I'm getting his blood pressure. Thank you, sir. Okay, now I will do his assessment starting at the head. The entire assessment, I am actually inspecting his skin as I go along. First thing, his scalp is soft. He's bald. Some hair growing. No lesions. No lice. No dandruff. Eyebrows are intact. Skin behind his ears intact. Hair is black with some grain. Several molds noted on eyelid and cheeks. Skin is intact. No lesions. No discolorations. Okay. All right. We're going down to your eyes. All right. I'm going to ask you to focus on that clock. And I'm going to shine the light. I want you to follow this pin. Okay. Pupils were 2 millimeters. Perla. Do you wear glasses?
Yes.
Client wears glasses. And do you wear hearing aids?
No.
Client does not wear hearing aids. Okay, now I will be checking your ears. Pulling on the auricle. No wax buildup. Ears are clear and patent. auricles are intact. Ears, both ears are clear and patent. No redness, lesions, or wax buildup. Okay, I'm gonna have to raise your bed up. It's a little more. I need to check. Okay, so right now I'm going to check for JVD. No JVD. Checking for carotid. Carotid arteries are strong and bounding. Lymph nodes. Trachea is in line. No lymph node enlargement. No movement. No swollen areas noted. Okay, now I'm looking to your nostrils. Nares are patent, no deviation. I'm going to ask you to breathe out of one side. All right, next side. Both sides are open and patent. All right, now I'm going to ask to look into your mouth. Taking his tongue out, his tongue is moist and pink. Mucosa is moist and pink, teeth are intact. No areas of darkened areas, gums are pink, moist, and intact. Okay, now we will do. Okay, now we would do the arms. Okay, so. Oh, yes. Okay. Okay, arms. Now I'm checking the pulse, radial pulse, bounding, brachial, bounding, skin turgor is good. It is intact. No dehydration noted, no tinting. All right, so now I will do the, my client is going to sleep. Now I will do range of motion first. Okay, sir, I know you want to get to sleep, so I'm going to speed up my time. All right, sir, would you do a range of motion for me, please? All right, shrug your shoulders. All right, can you move your wrist, your arms like this? All right, now can you move your wrists? All right, your fingers and your thumbs. All right, good job. Thank you, so perfect. All right, range of motion is intact and complete. Okay, and cap refill. Cap refill is less than 2 seconds. Okay, and strength. That's test. I want you to hold my fingers, Mr. Smith. Squeeze them as tight as you can. All right, now hold my fingers and pull against me. All right, and push against me. Okay, thank you. All right, strength is intact, strong. There was no weakness noted. And grit was strong. Okay, so now, all right, so now listen to lung sounds. As I'm listening to lung sounds, I am inspecting his chest wall and his scapula. Okay, I'm gonna ask you to sit up. Sit back. Take a deep breath in and out. One more, please. Okay, and breathe normal. Lungs are clear. Lungs are clear with no movement heard. I need you to take a deep breath for me, and then in and out. Okay. Back expansion is a T9. Okay. All right, you can lay back, please. Okay. Are you comfortable? Okay. 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 Lung sounds. Lungs in the front are clear and no movement heard. Okay, now I will listen to his heart sounds. Apical, pulmonic, herbs, tricuspid, mitral. Apical will be listened to for 60 seconds. I understand for the sake of time, that's why I'm doing it this way. Okay, so after heart sounds, after the apical sounds, I would listen to his abdomen. In all four quadrants, starting in the lower right quadrant. Bowel sounds are active, hyperactive. If bowel sounds weren't heard, I would have to listen for a full 5 minutes in each quadrant. Now I will lightly palpate, starting in the lower right. So I'm going in the exact sequence as I started. Then the second, no lobes, no nodules felt. Then I would do a firmer palpation in the same sequence. No lobes, no nodules felt. Skin, because of the sake of the video, skin is inspected. Skin is clear, no nodules. Abdomen is slightly distended and rounded. Mr. Smith, when was the last time you had a BM?
This morning.
Okay. Client states that he had a BM this morning. Okay. Okay, and also one thing I forgot to check his, I don't know why I'm thinking about it, his conjunctiva. Yeah. Conjunctiva is pink and moist. No, no, no discoloration. And his sclera are white. Pupils, like I said, pupils were 2 millimeters. Okay, so now, Mr. Smith, could you smile for me? All right, thank you. Okay. All right, now I will do the his legs and feet, I guess. Okay, I would check his expose one leg, checking his femoral artery, his popliteal, tibia, pedal. Skin is nice and tight, taut, dry and intact. Um, Absolutely no scars, no tubes, uh, apparatus off of his body. I've already checked the perineal area, both legs, femoral artery, popliteal, tibia, pedal. No edema. Cap refill on both toenails. 3. Less than 3. Heels look good. No discolorations, no skin breakdown or bony prominences over his body. Okay, Mr. Jones, could you wake up and stand up for me, please, and walk across the room? All right, we're just gonna do a little gait test. Just watch, see how you walk. All right, walk across the room. Okay, thank you. Gait is intact. No, let me stand. Okay, I must take you back. And his, all right, spine is straight. There is no lordosis. I can never say the word lordosis, humpback, and no lordosis, kyphosis. No kyphosis, no lordosis. And bend over, please, and just let your arms just dangle. Spine is straight. There's no curvature. S curvature to signal scoliosis. So no scoliosis seen. All right, thank you, sir. And get back in bed. Need some help?
No, Daddy, thank you.
Okay. Okay, now I'm going to also ask you, can you lay on your back? And we're going to do range of motion with your hip. Just even in the bed, just try to wriggle down. All right, to the other hip. Okay, and can you bend your knees? All right, arch out the knee. Okay, thank you. Wiggle your ankles. All right, can you wiggle your toes? All right, I'm going to let you, all right, lay straight. Push against my feet. Push your feet against my hands. Thank you. Push the pedal. There you go. Thank you. All right. And I think that's about all. Okay. Yep. All right. So let me have you back in bed. Okay. All right. Lower the bed. Zzz. The bed's lowered. And I pulled the side rail up. I gave him his call bell. And is there anything that I can assist you with that you need?
No, that's fine, man.
All right, thank you, sir. Thank you for your assistance today and allowing me to do your assessment.
Thank you.
You're welcome. All right, assessment's over. I've washed my hands. I've done hand sanitizer, and really, I've washed my hands with soap and water. And I have documented. I'll go and document everything that I assessed, that I found. All right, thank you.